The anterior tibialis is the muscles on the anterior side of the shin bone attaching to the tibia, hence the anterior tibialis. And it is going to be the muscles that actually attach to the top of the foot and provide dorsiflexion of the actual ankle. And so those muscles that you see right there, a lot of times you'll hear about people getting shin splints, for example, and that'll be a lot of times in those muscles. Now, I've talked about throughout the portion, we talked about two joint muscles, okay? And what that is two joint muscles. They cause movement at two joints. The primary movement of each muscle is indicated by an asterisk. For a two-joint muscle to assist when the movement that is not its primary function, the muscle must be stretched at one end. Okay, so let's think about this. On the hamstrings, the primary thing that the hamstring does is to flex the knee, or bend the knee, in other words. For it to help with its other motion, it must be stretched, okay? Hip extension is its other motion, okay? So like if I was to extend my hip back here, and we know, for example, two exercises that you can utilize for working your hamstrings are the leg curls, whether they are seated or prone, but also we talk about stiff-legged deadlifts being a hamstring motion. Well, that's an example of how it also utilizes hip extension when it's stretched. So if the primary movement is indicated by an asterisk for a two-joint muscle to assist with the movement that is not its primary function, the muscle must be stretched. So when you're doing a hip extension, because you can hip extend like this, but see, now I'm just using my glute and I'm not using my hamstring because it's not stretched. So my knee would have to be extended just like it says right here, so it's lengthened to assist and to do its other motion. The quadricep, its motion is to knee extend. It also helps with hip flexion, okay? If the knee is flexed, okay? Because when I flex my knee, my quadricep gets lengthened. So like an exaggerated would be to totally flex it like that. So if I want that rectus femoris, which I showed you earlier, to assist in flexing of the knee, I must keep my knee bent. So if my knee is straight and I do not want to use my rectus femoris, I only want to use my iliopsoas, my true only hip flexor, when I don't talk about my rectus femoris, I would keep my leg straight and go like this. Because now that muscle is shortened because it's extended. So if I flex my knee and do this, now I can use my rectus femoris to help in its other motion. The gastrocnemius helps with plantar. Its primary motion is plantar flexion, is heel raises or a calf raise. If I want to have it help me bend my knee, I must dorsiflex my ankle. I need to pull the top of my foot towards my shin, okay? Because then that stretches my gastrocnemius. So if I'm doing a leg curl and I take my ankle, pretend this is my ankle, and I don't have my toes pointed, but I really pull my ankle back and stretch the underside of that calf when I'm flexing my elbow like on a seated leg curl, then you're going to see the gastrocnemius being involved when the ankle is dorsiflexed, when you pull the top of the foot towards the shin. So these are two joint muscles, understanding that for a two joint muscle to assist with the movement that is not its primary function, the muscle must be stretched at one end. Stretching a two joint muscle, okay? I talked about this earlier just a little bit because the triceps are kind of like that in the sense that they are crisscrossing two joints, all right? Well, the hamstrings can assist the gluteus maximus with hip extension, which is just what I talked about, if the knee is extended. If you perform hip extension on all fours with the knee flexed, the hamstring is already shortened. It is contracted to flex the knee. That makes it difficult for the hamstring. So I was talking about earlier when I had the knee bent and I was going like that. Imagine if I was on all fours, okay? So if I just want to use my glutes, I wouldn't want to have my hamstring stretched. I want to have it bent, okay? So when I'm stretching my hamstrings, obviously you want to make sure that you're bending them further. If I just want to stretch my glute, that would be when I would flex the hip but bend the knee and isolate the actual gluteus maximus, okay? If you're doing a gastrocnemius, plantar flexion can assist with knee flexion. If you perform standing heel raises, the gastrocnemius is emphasized because it is stretched at the knee. If you perform seated raises, the soleus is emphasized, and that is because when the knee flexes and toes point, the gastrocnemius is loose at the knee, therefore the soleus is emphasized. Okay, so when you do a seated calf raise, in other words, because the knee joint is bent right here, there's less stretching going on from the insertion where the Achilles tendon is all the way to the gastroc, because that knee is bent. So there's some slack put in to that gastrocnemius, which puts a lot more load consequently on the soleus, which is why the soleus is isolated when we do seated calf raises versus when we're doing a standing calf raise. You're going to have a lot more gastrocnemius utilization. You don't have to be standing, but the key is that your knees are virtually straight. So meaning you don't want to hyperextend them. But let's say you're on a leg press and you were doing a leg press with your legs straight and actually doing a calf raise with that. You're not technically standing, but that's not the point. The point is whether or not your knees are bent or straight is the point. So on the stretching aspect of it, if I wanted to isolate and stretch my soleus, I would bend my knee and drop my heel, not just drop my heel and keep my leg straight, like if you're up against a wall and you were stretching, or if you're hanging off a platform like a 2x4. If I wanted to stretch my soleus, I would bend the knee, put the gastroc in slack, and then I would actually drop the heel towards the ground, isolating a stretch on the soleus. And that's the lower extremity 2 joint muscles.